palpation assessment feels most like massage. We can assess for hot and cold, wet and dry. Wet areas will feel sticky and often indicate dysfunction in the tissues. This is called drag palpation. Also areas that are rough and smooth. Hot, cold, wet, dry, rough and smooth. Next, we would palpate for ease and bind. Does the tissue lift? Deliberate movement of the skin and superficial fascia helps us assess for places where the tissues are binding. Sliding one muscle group over the other helps us identify if the tissues are moving efficiently back and forth. To assess for a particular muscle function, activate the muscle, in this instance gastrocnemius, and then also activate the antagonist to see if you can identify areas that do not relax as they should. Gentle rocking and shaking, oscillation, also gives us an idea of differences in tissue movement. To assess tissues in the deeper layers, we have to work underneath the more superficial layers. In this instance, I'm palpating for soleus, which is under gastrocnemius. Joint movement at the end of the range helps us identify if we have a hard end feel or a soft end feel. In most instances, we should not experience a hard end feel. The sequence is assess for hot and cold, rough and smooth, and wet and dry using drag palpation, ease and bind of superficial tissues, each helping us narrow down to where our target area is going to be. When the target area is identified, more specific palpation assessment can be used. Binding tissue indicates dysfunction. Moving the tissue into ease often is a corrective method. Lifting the tissue, skin rolling, bend force can also be used for palpation assessment by comparing one side to the other. This tissue is more restricted. Rhythmic compression on the ribs is similar to an end feel demonstrated on the ankle. The ribs should be springy and not restricted.